where we are today, and I'm not even getting into politics, but I'm curious to know your opinion. You've been a doctor for quite a while now, someone who we respect, but comparing today's healthcare system to when you got into the business, what's your opinion? I mean, like, what's the difference, and where are we having issues these days?
That's a great question. 50 years ago, let's say, it was very rare that a physician worked for a big healthcare institution, an academic center, or a hospital center. It was very rare, with something like 2%, 3% of those doctors. Now it's very rare that you see doctors independent in private practice. The vast majority of doctors work for some big organization, whether it be Kaiser or a other hospital group or healthcare organization. And I think it's unfortunate because in doing so, when your paycheck comes from somebody other than your patient, you tend to be biased. So if you work for a big organization and your patient needs a referral, you tend to only refer within that organization, order x-ray, order labs, order testing from that organization, and that may not necessarily be what's best for your patient.
Mm-hmm.
I mean, my practice, Newport Beach, California, we are independent, fiercely independent. We don't work for anybody but our patients. And so we can use anybody we want, anywhere we want, and it's what's best for patients. And I think in a nutshell, that is in part what's wrong with medicine these days, is that doctors are working for other people, not their patients, and big pharma is funding everything. Most of the medical research that goes on in our country is funded by big pharma. The doctors that conduct this research, funded by big pharma. The folks that write the summaries of the research, funded by big pharma. The journals that publish this research, heavily advertised by big pharma. So there's inherent bias in the system. I don't think that's good for patients. I think that is part of the corrupting influence that we see.